People suffering with chronic pain will try just about anything to feel better. A Rockville physical therapist now developed an unusual treatment he says could provide the solution many of us have been looking for. In Focus reporter Trang Do tried it out herself and has the story.
Yeah, Jamie, it looks a lot like slapping, hitting, and punching, but the people I interviewed swear it doesn't hurt and actually makes their pain go away. It may not be the most relaxing treatment, but physical therapist Andy Block swears by his unorthodox therapy. He calls it reflexive pattern therapy, or RPT. Block developed it over a decade, combining Eastern and Western techniques to help relieve pain.
The basic principle is to identify these involuntary patterns. And when I say involuntary, they're patterns of protection in the body that you're not aware of.
So what looks like slapping, punching, and pulling is really his way of resetting the body.
When you have problems with your phone, what do? You just want to reset it. So you just reset it almost like a default button. It's the same thing in the body, what I'm doing. I'm basically resetting the nervous system. And when you reset it, amazing things happen.
CrossFit competitor Teresa Luce credits RPT with helping her quickly bounce back from a serious back injury during a competition in March.
I was having difficulty bending over, and everything just kind of tightened up. I couldn't move.
Dropping out was not an option. Her teammate Jimmy Violand, trained by Block, spent hours working on Luce using a combination of RPT, meditation, and other therapies. Her team, 12 Labors CrossFit of Columbia, ended up qualifying for the worldwide competition. Luce gets emotional recalling it.
For RPT to come in and work on me the way that it did with Jimmy and Andy, it was a miracle that weekend. There was nothing else that was working.
Though Luce's pain was acute, Block developed RPT mainly for chronic pain sufferers like Billy Hunter. Hunter has suffered from arthritis for 6 years.
I was kind of intrigued because he's slapping folk around and everybody gets up off and says they feel better. I'm a skeptic by nature, so I did decide, because I've had this chronic back pain for over 6 years now.
After his first RPT treatment, he went from a skeptic to a believer.
It sounds very strange. It sounds very strange, but it works. And that's the important thing, it works. And I'm out of pain.
We asked Dr. Larry Plotkin, a chiropractor and kinesiology instructor at the University of Maryland, for his opinion on the unusual therapy.
There's not one perfect therapy for everybody. There's probably 5, 10, maybe even 15% of the population that's not going to respond to the normal, conventional, traditional stuff.
Dr. Plotkin says as long as patients are fully evaluated before any treatment, RPT is worth a shot for chronic pain sufferers who haven't been able to get relief elsewhere.
We're not doing surgery. We're not injecting anything into the body. We're not, medications, not that medications are bad, but we're not having to take a bunch of drugs, and sometimes you can have side effects to them. So assuming, again, the condition's been fully evaluated, it's definitely not something that, from what I could see, is going to be something that's going to harm them unless there is an acute condition where specifically maybe it should not be used for.
Block says RPT isn't a standalone treatment. It's meant to work hand in hand with other therapies to get people moving and working on getting stronger and healthier again.
My job is really to get them to feel better quickly. Their job is to get themselves well. So they have to be involved in their care to get themselves well. So it's not a cure, but it's curative.
Block says RPT is covered by most insurance companies as it is a form of physical therapy. It costs $175 for the initial evaluation and then $100 for follow-up visits.
I love it. Now, you tried it out yourself. How'd that go?
They kind of made me do it. No, it was kind of different for me because I'm not suffering from any kind of pain, so it was a little bit of a different experience. But I can tell you it doesn't hurt at all. And he was able to identify some tender spots in my back and sides that I hadn't even noticed. And then once he did RPT and then touched those same spots again, they didn't feel tender anymore. So I don't know how, but there was a difference.
No, I laid carpet all weekend. Can you hit me right here in the back? Oh, that feels much better. Wow,
I'm not trained, but we'll see, yeah.
How long did, real quick, how long did it take? I mean, before you noticed something?
Oh, well, I was only on the table for a couple minutes, yeah.
No kidding. Oh, man.
It's very quick.
Hey, if you're suffering, we'll do anything, right? All right, thanks, Trang, for that.